Hello everyone, my name is Dr. Gary Consiglia. I'm currently working as a sessional GP in the Southeastern Trust area. I CCT'd 2 years ago. I got involved with quality improvement through the EQUIP project in ST3 and have continued to provide support in the role as an EQUIP co-lead and mentor for the current ST3s for the past 2 years. I am very passionate about QI. I feel that we have a lot to learn, and it has provided me with lots of skills that I can take to different practices. I've implemented a fair few QI projects which have been successful, and the outcomes are still being used and recorded to this date, and I have a few projects ongoing at the minute. I'm here today to talk to you about selecting measures for your QI project. Hopefully this will be a short and sweet presentation on the different types of measures which we use in QI, and give you a better idea about how to go about choosing the correct measures for your project. So if I take you back to the QI cycle, by now hopefully you've chosen a project and diagnosed the problem area which you wish to improve. We then move on to planning the project and implementing certain aspects and ideas and testing whether they work or not. And it's the testing whether they work or not that is where the measures and what we measure and how we measure it is the important aspect here. Moving on to the model for improvement, the plan, do, study, act cycles which we use. Obviously our aim is what we're trying to accomplish from our project, and the first thing that comes to mind are lots of actions. What are we going to do? Ideas tend to come first, but it can be tricky to select actual measures of what we're improving. And the big question is, how will we know that any change we make will be an improvement to the overall system? So there are 3 types of measures that we need to think about throughout our QI projects. The first of which is an outcome measure. And this is basically, how does the system impact the values of the patient, their health and well-being, and what are the impacts on other stakeholders such as the staff and community? The big question here is, are we achieving the overall aim of the project? The second type of measures are process measures, and we need to ask ourselves, are the steps in the system performing as planned, and are we on track in our efforts to improve the system? And these are measures which are ongoing data collection, etc. You have to ask yourself, what are the moving parts of the project, and are they working as well as you hoped? The next type of measure, which is just as important as the others, are balancing measures. Are the changes you put in place causing new problems in another part of the system? This involves looking at the system as a whole and who else is involved. Does the change which makes your job easier cause more time and effort for someone else? And does your change create a safer care for one group of patients that you're interested in, but possibly affect the access of other patients in the surgery? Now, this isn't strictly true, but for every action, there's an equal and opposite reaction. It's not strictly true for QI, but you need to ask yourself, what reactions are you creating? I'm just going to run you through a few examples of projects which I have taken part in over the years and take you through the different measures which I used. So, first example was a project where I tried to improve the prescribing and follow-up of patients commenced on statins for the primary prevention of cardiovascular disease. And I was trying to improve the overall standard of what I thought was acceptable care to a standard of 80%. So my outcome measure was closely related to my aim. My outcome measure was the number of patients who were started on a statin achieving their cholesterol target. Within that overall process, then there was the process measures. So these are the individual moving parts which I measured as I went along, such as was the cholesterol target actually calculated, and how many times or what was the number of patients with the target calculated, the number of patients where lifestyle advice was given, the number of patients where follow-up bloods were arranged, and how many of those appointments were attended. Another thing that I thought was important to look at was if a target wasn't met, was there any action on that target and what? And I also created a EMIS template, and I measured how often it was being used when patients were started on a statin. On the flip side of this project, then you had to have a look at the overall impact on the surgery, people who worked there, and the patients. So because I was organising, trying to improve the follow-up of these people, it was, I had to be careful and mindful of the fact that there may be increased pressure on the treatment room and the nurses taking blood tests. So I looked at the number of extra treatment room appointments used specifically for the purpose of my QI project. I looked at any extra time that was needed for the doctor to use my new Mango template. I also looked at if there was any increased workload because there was more bloods, more people attending for review, more people attending for follow-up bloods. Was that increasing workload for GPs in the mornings? And obviously, if you check bloods, you're going to find abnormal results. So there's a possibility that there would be an increased amount of follow-up appointments for discussion of cholesterol and other lifestyle measures. The second example was a project where I tried to improve the time efficiency when completing medical care plans. So these medical care plans were annual sort of comprehensive care plans for elderly patients. Some were done in the surgery, most of them done in the surgery, a few were done as home visits. I looked at the process, and it was a very sort of outdated, paper-heavy process with lots of repetition, writing down data, transferring data into computer systems, photocopying paper, posting to patients, and basically it was quite annoying to do, and it was taking a lot of time. So I devised a system and project where I would automate a lot of it, try and remove as much admin staff commitment to completing these medical care plans, using a template and some trickery on EMIS to wipe out all the repetition stages of this. My outcome measure was, again, closely related to the aim of my project, where I measured the percentage of time saved overall compared to the previous process. The process measures of the moving parts of the project, which I looked at closely, were the number of patients having a care plan completed with my new template, the time taken for an admin staff on average to organise the care plan in the new format, and the time taken for clinical staff to complete this care plan. Then had to be aware of the balancing measures. So any new process takes time, especially when you're sort of implementing it across numerous members of staff. So I had to take time to educate the admin staff and all the clinical staff individually on the new process, and because I successfully reduced the amount of time taken to complete one medical care plan on average, there was the potential for increased workload for everyone, in the sense that more patients could actually be seen per session. I basically turned a 30-minute process into a 20-minute process. So over this period of a 4-hour session, that could have meant that someone had to do an extra care plan or possibly 2 extra care plans. Hopefully that's give you a little bit of insight into the choice of measures that could be applicable to any project. I have some top tips I just wish to share with you. Your outcome measure should be closely related to the aim of your project. It's the overall outcome that you're trying to improve. It has to be patient specific or staff specific, or whatever context your project is in. The use of a process map, which should be covered in another area of these talks, can help you figure out which process measures are most important to your project. When you break down each individual step of a current process and figure out the parts that you wish to add, remove, change, they can also be things to measure. Are they working? If you change something, you should really measure it. Balancing measures aren't always obvious. You might feel that your project is brilliant and working fine and working great for the surgery and your patients, but actually feedback is really important throughout. Get feedback from yourself, from your colleagues and patients along the way. I'm going to give you a few examples of things which turned out to be balancing measures for me, and this was through feedback. One was, we've used up all the treatment room appointments because of your project, doctor. So again, I had to think about ways of measuring that, ways of improving. Again, one doctor said to me, it took me 20 minutes to fill out that new template. Is this supposed to save time? So again, you have to go back and look at these things. And doctor, I don't have time to come to all these appointments. What you feel is perhaps better care for the patient might be cause the patient more trouble in the end. So you do need to have a think about all these aspects. So hopefully this has provided you with a bit of an overview of choosing measures, 3 types of measures for your project. If you have any difficulty with this, please feel free to organise our Quick Plus sessions. We're more than happy to help. If you're struggling to choose measures or have any difficulty, please get in touch. Thank you.